From its inception, HaysMed has provided all of us in Western Kansas with exceptional health care. Over the years, we have taken dramatic steps forward to ensure that we are prepared to serve the health care needs of our region. We continue to add outstanding medical staff. We rival larger Kansas communities in our ability to develop innovative new services and facilities. Clearly, HaysMed is transforming healthcare for our region.
This building project is really in 5 major components. The biggest piece, the one that will be most visible to the public, is a large tower that we're going to put on the south side of the campus that will attach the Bickle pavilions and the Miller pavilions. The second floor of the south tower will be a new clinic for our cardiologists and cardiovascular surgeons and all the staff that work with those physicians. Their clinic right now is on the 3rd floor of the Miller Medical Pavilion. They're very crowded. It's very tight. We continue to renovate and work with that space, but we bring in new doctors, new mid-level providers, more nurses, more staff. They simply are out of room. Probably one of the more challenging components is going into the patient bathrooms of the original patient tower, which was actually completed in 1972, and doing heavy renovation of these bathrooms, as well as some cosmetic renovations of the patient rooms. Our patient rooms, again, almost 40 years old. A lot of the pipes are almost 40 years old. The bathrooms themselves have some limitations in getting patients into the shower that have physical disabilities. We're also going to be starting a major renovation in the outpatient oncology area. There will be some new construction to the north side of the campus to expand some of the public area for the cancer department. We hope to come in a few years and actually do an additional expansion of the treatment areas. We'll also be going into the area which would be typically called labor and delivery, doing an enlargement and a fairly significant remodeling of some of the treatment areas. We take care of most of the high-risk deliveries in northwest Kansas, and while this area was designed in the mid-1990s, there's been enough changes in technology and demands on our services that we feel some modifications are in order. We'll be putting in an additional cesarean section room for surgical deliveries, an additional labor delivery recovery room, and some other things that will be of great benefit to patients, families, and our staff. We have started a few months ago a high-risk breast center, and we have our breast imaging both located over at the Oak Park Medical Complex. For some time we've thought we'd like to bring those onto the campus. With this project, it gives us an opportunity to move a lot of our administrative people, which are in the north end of the building, to the 4th floor of this new south tower. Once we've moved all these folks, we're then going to go back in and remodel the north administration area as a new home for our breast imaging and our high-risk breast clinic. The project will be completed in about a year and a half. The patient bathrooms in the main tower are pretty time-consuming because of the number of different phases to it. The total cost of the construction is estimated to be around $18.5 million.
We have the right plan for the right time to set HMC into the next decade in medical services for Ellis County and western Kansas.
This entire project is estimated to cost about $18.5 million. It's being funded with HaysMed through the HaysMed Foundation through the use of a generous capital campaign. Our goal is to continue HaysMed as the leading tertiary care center in rural America. To do that, the gifts for this project to the HaysMed Foundation will make a very large effort and to continue the way that we do that, and will ensure that we will continue to have high-quality regional and tertiary health care in western Kansas.
Our campaign goal is to raise $5 million for this current project, and we, as members of the foundation, feel that it's incumbent upon us to make a pledge also, and we have committed for almost $1.5 million from our foundation, so that we feel that we can come and ask for your help and your support.
Funds raised in this capital campaign will focus on 5 key areas of expansion and renovation. HaysMed is committed to investing in the highest quality patient care. However, net revenue from patient services is not sufficient to provide for new construction or the high cost of major medical equipment. Without private support, from our community.
We ask that you thoughtfully consider in making an investment in the future of health care for all of our family and friends in Western Kansas by making a contribution to our capital campaign. Your continued support and contributions to this campaign and Hays Medical Center will make a difference in helping us change lives for the better.